Kidney disorder can cause illness and even death. These disorders take place by aging, internal and external factors. Kidney stones are stone-like materials, known as calculus, formed at any level in the urinary system, such as in Bowman's capsule, pelvis of the kidney, ureter, and urinary bladder. They cause obstruction in the urinary tract. About 70% of kidney patients possess stones of calcium due to hypercalcemia or calcium oxalate due to hyperoxaluria. Calcium is found in fruits, green vegetables, milk, curd, and eggs, while oxalate is found in tomatoes and green vegetables. Sometimes stones of magnesium, ammonium phosphate, uric acid, and cysteine amino acid are also observed. Small stones can be removed by medicine or by drinking plenty of water, while large stones can be removed either by surgery or by a non-surgical method, like lithotripsy. In lithotripsy, stones are broken down by non-electric extracorporeal shock waves generated outside the body and bombarded on the stones. This breaks the stone, which becomes sand-like and is passed through urine. Renal or kidney failure is the inability of kidneys to regulate a constant internal environment and to meet the metabolic demand of the body. The causes of renal failure include diabetes, mellitus, hypertension, and other pathological and chemical factors. The symptoms of renal failure are pain in the lower abdomen, severe pain in the kidneys, vomiting, frequent urination, blood in urine, and weight loss. Excess water in the body may result in swelling of body parts like legs, feet, face, and breathlessness. Dialysis is the procedure of cleaning the blood. In this procedure, the diffusion of dissolved molecules in the blood passes through a semi-permeable membrane, also known as an artificial kidney or dialyzer, which has pore sizes that allow only small molecules to pass through it. Haemodialysis. Haemodialysis means cleaning blood. In this procedure, the patient's blood from the artery in the arm flows through a machine which contains a dialyzer, also called an artificial kidney. The blood circulates continuously between two twin porous membranes of cellophane and outside the membrane in dialyzing fluid. The membrane allows the constituents of the plasma, except the plasma proteins, to diffuse in both directions. The blood circulates slowly, and the exchange between the blood and the dialyzing solution continues until equilibrium is reached. Peritoneal dialysis. In this type, a thin porous membrane is required for dialysis. The peritoneum is a thin epithelium lining the abdominal cavity, which contains blood vessels. A thin plastic tube is inserted into the abdominal cavity through a slit in the abdominal wall and can be left in permanently. The tube is filled with dialysis fluid and left for several hours before removal. Exchange of solutes takes place between the fluids and the rest of the abdomen. The fluid should be replaced regularly, 3 to 4 times per day. In between, the patient can be mobile and free to live a relatively normal life. Kidney transplant. Dialysis helps to remove wastes, but it is a temporary measure. In high-degree renal failure, transplantation is the only solution. A matching donor kidney is needed for the transplant. The best donor is a twin or any close relative. The average survival time of a donor kidney is 10 to 15 years. A second kidney transplant is also possible. Contributions of Muslim scientists about renal disorders. Contribution of Abul Qasim. Abul Qasim Khalaf ibn al-Abbas al-Zahrawi, who lived from 936 to 1013 AD, is considered to be one of the great Muslim surgeons. He invented many surgical methods. The most important one is the operational method to remove the kidney stone from the urinary bladder. He also dissected animals and performed surgery on the eye, ear, and throat. His famous encyclopedia, Al-Tasrif, which means the methods, describes more than 200 surgical instruments. Contribution of Abu Nasr al-Farabi, who lived from 872 to 951 AD. He wrote many books in which he explained much information about diseases of the kidney. Kitab al-Burhan and the philosophy of al-Farabi are his famous books.